Every tooth in a man's head is more valuable than a diamond. If you look at the title of this video and think that it can't be taken literally, think again. Every tooth is actually worth around the piece of a small diamond to you. If you lose a tooth because of lack of care for that tooth and its effect on overall health, the amount of money that you will have to pay in order to repair the subsequent damages will total up to about the price of a diamond. Instead of paying a diamond ransom because you don't feel like caring for your teeth and health, it is much easier, less painful, and less expensive to engage in preventive measures that can save you a lot of money. Let me explain. Our mouth or oral cavity consists of lips, gums, teeth, palate, and tongue. Its main function are eating and speaking. The teeth are the hardest substance in human body and consist of enamel, the hardest white outer part of tooth, dentine, a hard tissue layer underlying the enamel, and pulp, inner structure consisting of blood vessels and nerves. Oral cavity collects all sort of bacteria, viruses, and fungi. Some of them belong there, making up the normal flora of the mouth. They are generally harmless and in small quantities. Bacteria near gum line thrive in a sticky matrix formed by a combination of bacteria, acid, and carbohydrates, called plaque, that constantly forms on teeth. These bacteria produce acid after we eat or drink food containing carbs such as milk, soft drinks, cakes, or candies, and are frequently left on the teeth. This acid dissolves the tooth enamel by removing minerals and causes dental cavities and tooth infections. Plaque also accumulates, hardens, and migrates down the length of root. This can inflame gums. Increased inflammation causes your gum to begin to pull away from teeth, creating a pocket in which pus may eventually collect and can cause breakdown of the bone that support the teeth, lead to tooth loss. A fuzzy feeling on teeth is the top sign that you have plaque. Other indicators are chronic bad breath, red, swollen, tender gums that bleed after brushing. Dental plaque is a common problem with an easy fix. Brush and floss daily and see your dentist and have your teeth cleaned at least twice a year. We use our teeth and mouth for a lot, so it's not surprising how many things can go wrong over time, especially if you don't take proper care of your teeth. Dental and oral diseases include cavities. These are permanently damaged area of tooth and may even have holes in them caused by plaque. The damage can be only in enamel or can extend to dentine and can even reach pulp. If left untreated, can cause pulpitis and dental abscess. A tooth can crack or break from an injury to the mouth, chewing hard foods, or grinding the teeth at night. Cracked teeth can be very painful. You can also have tooth sensitivity and might feel pain and discomfort after having hot or cold food or drink. It sometimes temporarily occurs after root canal or a filling and can also be result of gum disease, receding gums, cracked teeth, worn down filling or crown. It can also occur in people with thinner enamel. When it comes to your oral health, it's not all about how straight your teeth are or how bright your smile is. You cannot forget about your gums. Even if you are cavity free, that doesn't mean you are immune to gum disease. Since it's usually painless, most people have no idea that anything is wrong with their gums. Gum disease starts when plaque built up under and along the gum line, causing inflammation, tenderness, redness, swelling, and bleeding of gum, a condition called gingivitis. Fortunately, since bone and tissue holding teeth are not impacted, this damage is reversible. But if left untreated, gingivitis can lead to periodontitis that impact the bone that hold the teeth in place. If left untreated, it can ruin the gums, bones, and tissue connected to your teeth. The final stage of gum disease is advanced periodontitis. This is when the fibers and bones supporting teeth are destroyed. It can impact your bite and teeth may need to be removed. You should not wait until you have symptoms to visit your dentist. Visiting dentist twice a year will usually allow them to catch a problem before you even notice any symptoms. But if you experience any of the following warning signs, see your dentist as soon as possible. Ulcer or sore that won't heal after a week or two, bleeding or swollen gums after brushing or flossing, chronic bad breath, sudden sensitivity to hot or cold food, toothache, separating or loose teeth, receding gums, pain on chewing or biting, swelling of face or cheek, clicking of jaw, cracked or broken teeth, frequent dry mouth. Oral health is so much more than just preventing cavities. It can affect the health of our whole body. Oral cavity contain a lot of bacteria as it is the entry point to digestive and respiratory tract. Some of these bacteria can escape into the bloodstream and can cause disease. Poor oral health might contribute to various diseases including endocarditis, that is infection of inner lining of your heart chamber or valves. Oral bacteria can cause inflammation and infection that can result in heart disease and stroke. Periodontitis has been linked to premature birth and low birth weight. Some bacteria in your mouth can be pulled into your lungs causing pneumonia and other respiratory disease. Infection from a tooth abscess can spread to other parts of head and neck and can even lead to sepsis, a life-threatening blood infection. Periodontal disease caused by a bacteria named F. nucleatum leads directly to Alzheimer's disease and if left untreated or poorly treated could exacerbate symptoms of Alzheimer's disease and lead to dementia. Periodontitis is also a risk factor for rheumatoid arthritis. On the other hand, certain conditions also might affect your oral health, like gum disease appears to be more frequent and severe among people who have diabetes. Oral problems such as painful mucosal lesions are common in people who have HIV and AIDS. Osteoporosis is a bone weakening disease linked with periodontal bone loss and tooth loss. People are at higher risk of having oral health problems who are struggling with anemia, eating disorders, and cancer. Hyperthyroid patient, women going through hormonal changes like pregnancy, and tobacco users. Certain dietary habits including snacking on high sugar foods, drinking sugary and acidic drinks, and eating sticky foods can cause tooth decay. Children are highly susceptible to dental cavities and tooth decay, especially those who bottle feed because too much sugar is left on teeth. To avoid tooth decay, you should do the following. Only bottle feed during mealtime. Wean your child off of a bottle by the age of 1 year. Fill the bottle with water if you must give them a bottle at bedtime. Begin brushing with soft baby toothbrush once their baby teeth start to come in. Use only water until your child learns not to swallow toothpaste. Your child should start seeing a dentist by their first birthday. Men are less likely to take good care of their teeth and gums, brush twice daily, floss regularly, and seek preventive dental care. This is the main reason why oral and throat cancer is more common in men. A 2008 study showed that men with history of gum disease are 14% more likely to develop other type of cancer than men with healthy gums. It is important that men recognize the consequences of poor oral health and take action early in life. Due to changing hormones at various stages of their lives, women are at risk of oral health issues. They can experience mouth sores and swollen gums during menstrual period. During pregnancy, increased hormones affect amount of saliva produced and frequent vomiting can make oral environment more acidic, resulting in tooth decay, tooth sensitivity, and swollen gums. Dental care can be received during pregnancy, but you should let your dentist know if you are pregnant. During menopause, lower amount of estrogen can increase your risk of gum disease. Diabetes affect the body's ability to fight off bacteria and have a high risk of oral infection, gum disease, periodontitis, and a fungal infection called thrush. It causes white or yellowish spot to form on inner cheek, tongue, and gums. For people with diabetes, it is important to maintain control over their blood sugar levels along with oral hygiene. Good oral health boils down to good general health and common sense. The best way to prevent oral health problems are to brush your teeth with fluoride toothpaste at least twice daily for 2 minutes each time using a soft bristled brush. Floss at least once a day. Follow a high fiber, low fat, low sugar diet that includes plenty of fruit and vegetables. Limit sugary snacks and drinks. Avoid tobacco product. Replace your toothbrush every 3 to 4 months or sooner if bristles are splayed or worn because bacteria can harbor in the bristle. Rinse your toothbrush out with hot water after every use. and change it after you have been sick. Even if you have been taking good care of your teeth, you should visit your dentist twice a year for regular checkups and cleaning to prevent cavities and gum problem. Don't wait until you have a problem before you see your dentist. Help prevent problems before they happen. Dental problems do not get better or go away without treatment, so if your dentist gives you a treatment plan, you should focus on getting your teeth fixed as soon as possible. Otherwise, the problem becomes severe and the treatment becomes expensive. Dentists will recommend the following treatment according to your need: cleaning, that is scaling and root planning; fluoride treatment that can help strengthen the enamel of your tooth; filling, crowns, and sealants if some area of the tooth is damaged; root canal treatment if bacteria have reached the pulp; extraction of teeth in case of tooth abscess or severe periodontitis; replacement of extracted teeth by bridges and denture.